The top stories tonight in Y News. World health experts warn that the coronavirus pandemic will be far more deadly this year.
Mayors and governors now included in the COVID-19 vaccination top priority list in the Philippines.
Former Senate President Juan Ponce Enrile to discuss tonight how the Philippines lost one of its territories to China. Normal operation of the fire-damaged rooms of the Philippine General Hospital would likely return in about 3 or 4 months.
A woman assumed dead after being infected with COVID-19 wakes up before cremation.
And Miss Mexico crowned as Miss Universe 2021. Good evening, Philippines and the world. We are now live, and it is Monday, May 17, 2021. I am William Theo.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I am Elsie Marcos.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am Pat Maraos.
First in the news. World health experts warn that this year's pandemic was likely to be deadlier than the first. Meanwhile, wealthier nations are urged to postpone plans to give children and teachers COVID-19 vaccines and instead donate supplies to low-income countries. Nina Bascon reports why.
World Health Organization's Director General Tedros Adhanom Ghebreyesus on Friday issued a grim warning that the second year for the global pandemic is on track to be far more deadly than 2020.
We're on track for the second year of this pandemic to be far more deadly than the first.
Tedros urged rich countries to reconsider plans to vaccinate children and instead donate COVID-19 shots to the COVAX scheme for low and lower middle-income countries.
These countries are in heightened response mode, and WHO will continue to provide support in all ways possible.
The WHO is hoping more countries will follow France and Sweden in donating shots to COVAX after inoculating their priority populations to help address a gulf in vaccination rates. Canada and the United States are among the countries that have authorized vaccines for use in adolescents in recent weeks. However, a WHO official said talks with Washington on sharing doses were underway. COVAX, which has delivered around 60 million doses so far, has struggled to meet supply targets, partly because of Indian export restrictions on the AstraZeneca vaccine due to its growing pandemic. So far, around 1.26 billion doses of COVID-19 vaccines have been administered globally. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
The Interagency Task Force for the Management of Emerging Infectious Diseases has included mayors and governors in the top priority group for the government's COVID-19 vaccination. Aiko Miguel will give us the details live. Yes, Aiko, good evening. Go ahead.
Yes, William, good evening. Under Resolution Number 115B, all governors and mayors or all local chief executives will now be among the priority group A 1.5 for vaccination, regardless of the risk classification of their respective local government units or LGU. The country has around 1,634 provincial governors and city and municipal mayors. They were previously under the fourth sector or A4 category, composed of essential workers. But according to the Department of Health, they are now included to the sectors or groups who are often exposed and most likely to get infected with COVID-19. Here is Undersecretary Maria Rosario Vergara, the spokesperson of the Department of Health.
Because during that time, nung tayo po ay nagbabakuna ng healthcare workers, kakaunti lang po talaga ang doses natin ng bakuna. At gustong-gusto po natin talaga na mabigyan muna lahat ng ating healthcare workers, kaya po hindi muna tayo nagsama ng ibang priority sectors.
Malacanang defended that aside from healthcare workers, local officials are also considered as frontliners for they lead the government's COVID-19 response. Here is Secretary Harry Roque, the presidential spokesperson.
Ang mga mayor at gobernador ang nagpapatupad po ng prevention, detection, isolation, treatment, and rehabilitation na cornerstone of our COVID program. Sila po nagpapatupad ng localized lockdown. Sila po nagpapatupad ng vaccination. Sila po talaga ang ating instrumento dito sa paglaban natin sa COVID-19. They may not be doctors, but they are equally frontliners dahil lahat po ng strategiya natin ang humaharap po ang mga lokal na opisyales, si Mayor at si Governor.
William, the DOH also said it is a good indication and vaccine confidence that many Filipinos go to vaccination sites. But the Department of Health prohibits walking in vaccination centers.
Magkakaroon din po tayo at malapit na po iyan itong simultaneous vaccinations to expand to A4 and A5. Kailangan lang po tayo mag-antay, unahin muna natin yung mga vulnerables natin bago po tayo pumunta dun sa ating facilities for vaccination. Ang isa ho nating issue dyan kasi pag pumupunta kayo dyan tapos hindi naman ho kayo mababakunahan, ini-expose nyo pa ho yung sarili nyo sa maraming tao at baka kayo ay magkasakit pa. So it would be better to wait for your turn.
William, in June, the government targets to start the inoculation of groups A4 or government and economic frontliners and A5 or indigent population. And in August, 35% of the adult population are expected to be inoculated. Meanwhile, there had been series of meeting by the DOH and the Department of Science and Technology Vaccine Expert Panel to tackle the conduct of clinical trial on booster COVID-19 shots and mix and match of COVID-19 vaccines.
Kasama rin din po sa pag-aaral na ito, itong pagbibigay ng additional shot, which is a different brand from those who have completed 2 doses already.
William, the DOH and DOST are now finalizing their plan before they announce when to start the said clinical trial. And that is the latest live. Back to you, William.
Yes, thank you very much, Aiko Miguel, for those live updates.
The Philippines' cumulative tally of novel coronavirus disease cases climbed to 1,149,925 after the Department of Health or DOH reported 5,979 additional infections today. In the latest bulletin, the DOH said the number of active cases has reached 54,235, of which 93.3% are mild, 2% are asymptomatic, 1.25% are moderate, 2% are severe, and 1.4% are in critical condition. The DOH said 5 laboratories failed to submit data on time. Total recoveries climbed to 1,076,428 after 6,602 more patients survived the viral respiratory disease. The death toll rose to 19,262 with 72 new fatalities. Meanwhile, as of May 15, the Philippines has fully vaccinated 675,799 Filipinos, or 0.61% of the population. The country is now administering an average of 75,100 vaccinations daily. We currently have a supply of 7,779,050 doses of Sinovac, AstraZeneca, Pfizer, and Sputnik vaccines. It may take 3 to 4 months before the Philippine General Hospital's operating room supply can resume after a fire broke out at the hospital yesterday. Meanwhile, the hospital estimates the damage left by the fire to be worth at least 50 million pesos. Marvin Calas reports.
Emergency rooms at the Philippine General Hospital were temporarily closed today. Nevertheless, almost all patients were placed back to their respective wards, according to PGH Director Dr. Gerardo Legaspi. Due to the hospital's limited operations, the public is advised to coordinate with the One Hospital Command Center before proceeding to PGH.
So sa ngayon po, sarado muna ang emergency room. Kaya kung meron pong darating na pasyente dito, baka ilipat muna namin to the efforts of the One Hospital Command. Pero yung mga nasa ward po, wala na po kaming ililipat muna ngayon dahil nag-uumpisa na ho kaming magplano ng serbisyo sa kanila.
Dr. Legazpi says 5 sterilization units of the hospital were greatly affected. Medical supplies and equipments were kept in the facility, and the same is where sterilization of medical equipments were conducted for patient surgery operations. Despite the incident, regular operating rooms in PGH resumed operations. The hospital is now coordinating with other hospitals in the performance of surgery operations on patients. The PGH management says it would take 3 to 4 months before the resumption of normal operations in the said facilities. Critical surgeries such as neurosurgery, heart transplant, and other advanced surgeries remain suspended. The hospital management, on the other hand, assured on finding ways to resume the critical surgery operations as soon as possible.
So, yun po yung malaking naapektuhan sa amin, yung aming kakayahang magbigay ng mga serbisyo sa pag-oopera. Pero handa naman ho kaming mag-umpisa sa lalong madaling panahon para maituloy po ito. Maaring hindi kasing dami nung dati, but slowly, maghahanap po kami ng paraan.
COVID patient admittance at the hospital will also resume tomorrow. Meanwhile, no final results of the investigation were yet announced by the Bureau of Fire Protection, but the suspected cause of the fire is due to a defective electrical line. Dr. Legazpi estimates an initial 50 million pesos cost of damage by the fire incident. Marvin Calas, UNTV, News and Rescue. We serve the people, we give glory to God.
The fire-hit Philippine General Hospital will resume accepting COVID-19 patients tomorrow. Meanwhile, President Rodrigo Duterte could tap the Presidential Social Fund to repair the damages in the hospital. Rosalie Cos explains why.
The Philippine General Hospital fire over the weekend damaged an estimate of around 50 million pesos worth of hospital equipment. The total cause of damage has yet to be determined, but the operating room supply area was the most affected. According to Presidential spokesperson Harry Roque, the Presidential Social Fund can be used to assist in the rehabilitation of the hospital.
So ang presidente po, Doc Legazpi, kung anong kailangan nyo, sabihin nyo lang. Because dati na siya nag-offer na mas malaking halaga. So kung anong kinakailangan po ngayon para ma-repair ang mga damage, pwede pong itap yung Presidential Social Fund dahil yan po ay dati na pong in-offer sa PGH.
PGH receives 25 million pesos monthly from the Presidential Social Fund, and this is utilized to assist patients. Meanwhile, the hospital will resume accepting COVID-19 patients on Tuesday, May 18. No casualties or injuries were reported from the blaze. PGH is the largest COVID-19 referral hospital in the country.
We stand committed with our COVID role as COVID referral center po. But as I said, just for today, para lang mabakante pa yung mga ibang lugar at safe silang mailagay sa mga areas na kasi may huling check namin, may amoy pa ho ng smoke.
Meanwhile, the Department of Public Works and Highways inspected the PGH to determine the extent of the damage as well as the necessary rehabilitation works.
Siyempre, tutulong po kami sa repair ng na-damage na portion. And as the engineering arm of the government, siyempre, pag may mga pangangailangan ng ating mga government infrastructures, kami po yung tutulong.
Currently, the cause of the fire is still being under investigation, but based on initial findings, it could be because of faulty electrical wiring or circuit breaker. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
A lawmaker has warned Health Secretary Francisco Duque III that he could be cited in contempt due to his absence in the congressional inquiries. But the Health Secretary defended his absence. Harleen Delgado will tell us why.
Several lawmakers in the lower chamber criticized the absence of two of the country's top officials in the health sector in today's House Committee on Good Governance and Public Accountability's hearing on the alleged questionable guidelines and policies of the Department of Health and the Food and Drug Administration. Anak Kalusugan Party List Representative Mike Defensor has moved for the committee to cite Health Secretary Francisco Duque III in contempt should he fail to attend the panel's next inquiry.
On two occasions, Mr. Chairman, si Secretary Duque po hindi na ho umattend sa hearings natin. Very critical po dito yung mga usapan, lalo tigit yung actions on policy ng Department of Health. I do not want to say that the committee is being snubbed, but seemingly yun po ang nangyayari.
Committee Chairperson Representative Michael Aglipay says he has yet to hear the Secretary's official reason for his absence and that he has sent representatives instead. Defensor and Deputy Speaker Lito Atienza also questioned FDA Director General Eric Domingo's absence.
Would Congress allow this, and not only for this particular occasion, but for future inquiries? By the convenient way of taking a leave, can they avoid congressional inquiry on their official decision?
Naintindihan ko po, may problema siya, but again, it is a public health emergency.
Aglipay then explained that Domingo is now on 1-month leave and his absence was due to personal reasons.
His father is sick and he has filed the 1-month leave because of this. I think he is the last person who will avoid an inquiry given his previous attendance in various committees and various inquiries.
In a statement, Secretary Duque says the department is taking congressional hearings seriously and his failure to attend inquiries is due to his responsibility in leading the country's COVID-19 response. He adds today's House hearing has coincided with his preparation for the meeting with President Rodrigo Duterte. The Secretary also said he has delegated attendance to appropriate teams who are equipped to answer the queries in the hearings. The next House Committee hearing is set on June 10. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
Former Senate President Juan Ponce Enrile will talk at President Rodrigo Duterte's public address tonight to discuss how the Philippines lost control of one of its territories to China. Rosalie Cos explains why.
Former Senator Juan Ponce Enrile will discuss the roles of former Senator Antonio Trillanes IV and former Foreign Affairs Secretary Albert Del Rosario on the West Philippine Sea issue. According to the palace, Enrile accepted President Rodrigo Duterte's invitation to discuss the history behind China's seizure of the Scarborough Shoal under the Aquino administration.
Sabi nga ng Pangulo, former Senator Enrile was there right at the beginning. Kinakailangan po nating pakinggan ang sasabihin ng dating senador dahil magandang malaman ang papel ni dating senador sa Antonio Trillanes at dating Secretary Albert Del Rosario sa usapin ng pagkawala ng Scarborough Shoal sa Pilipinas.
The palace reiterated that the 2012 Scarborough Shoal standoff started all the controversies and the tension between the Philippines and China in the disputed territory. During this period also, Malacanang said that China has started its massive occupation and reclamation in the area.
Huwag niyong kakalimutan bilang gante ng China nga doon sa ating arbitration, ibig sabihin, yung Scarborough Shoal incident din ang naging dahilan kung bakit nagkaroon po ng mga base militar ngayon ang China doon sa mga artificial islands na karamihan po ay kabahagi na ating exclusive economic zone.
Meanwhile, Enrile's opinion, being the former Defense Secretary, will also be sought on the issue of the Mutual Defense Treaty and Visiting Forces Agreement between the Philippines and the United States of America. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine National Police and the Philippine Drug Enforcement Agency are crafting a unified operational guidelines and protocols that shall be observed when conducting anti-illegal drugs operations. Lea Ilagan will tell us why.
The Philippine National Police or PNP and the Philippine Drug Enforcement Agency or PDEA are crafting guidelines on law enforcement operation to avoid miscommunication. PNP Chief Police General Guillermo Eleazar and PDEA Director General Wilkins Villanueva met on Saturday to discuss ways on how to improve coordination, collaboration, and cooperation of PNP and PDEA operating units to avoid previous incidents of misencounter during illegal drug operations. Eleazar said among the salient points discussed include more rigid coordination procedures that must clearly indicate the specific areas of operation at the station level in big cities.
Hindi dapat mag-operate yung operatiba ng PNP at PDEA sa isang lugar. Sa parehong panahon o parehong oras. Otherwise, mag-joint operation tayo.
Eleazar earlier noted that illegal drug syndicates are taking advantage of the weaknesses or gaps in the rules of procedure on coordination and inter-operations between the PNP and the PDEA. The police chief added that the operations carried out by the PNP and PDEA last Friday, May 14 were both legal.
The same group, pero mga different personality yung kanilang mga target. Kaya nga nagkaroon ng nagparagpo sila doon. Ang problema is actually not the operation because they have their own legitimate operations. So ang problema talaga bottom line is, bakit kayo nagparagpo dyan? Well, PDEA, nag-coordinate sila, specifically doon sa station na under doon, which is station 16. Pero coordinate din sila, kaya lang sinabi na Quezon City.
Last February, elements of Quezon City Police and PDEA agents figured in a shootout along Commonwealth Avenue during a supposed anti-drug operation. 3 people died as a result. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, the government's Anti-insurgency task force explained that there is a legal remedy for persons who are designated as terrorists. However, the Anti-Terror Council, or ATC, believes they have probable cause warranting the designation. Nel Maribuhok explains why.
The National Task Force to End Local Communist Armed Conflict, or NTFL-CAC, assures the due process for the 19 people designated as terrorists, including Communist Party of the Philippines founding chairman Joe Masison. According to Attorney Marlon Busantog, one of NTFL-CAC's spokespersons, those designated terrorists may go to the Supreme Court or SC, and the highest court could step in on the issue of the legality of the terrorist list.
It is done under the premise of due process. Number one, we have the ATC. It was passed by Congress. They have remedies available to them. Kahit ngayong decision ng ATC can actually be questioned before the Supreme Court because the Supreme Court has an overarching power when it comes to actions by the Executive Department. So they can actually review the actions of the ATC.
Under the anti-terror law, the Anti-Money Laundering Council is authorized to immediately freeze the assets, property, or funds that are in any way related to financing of terrorism. The freeze order will be effective for 20 days. The designated people can go to the Court of Appeals to challenge the basis of the freeze order. Despite this, the Anti-Terror Council, or ATC, emphasized that they have enough basis to designate the 19 individuals as terrorists.
The designation of these individuals is based on probable cause. When I say probable cause, there are pieces of evidence submitted to the ATC. However, this evidence is not available to the public.
ATC refused to divulge the details of their evidence as well as processes involved in designating a person as terrorist. This is because of the ongoing oral argument in the Supreme Court questioning the constitutionality of the anti-terror law. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
Retired Supreme Court Associate Justice Francis Hardalesa asked the Supreme Court to junk the 37 petitions assailing the constitutionality of the Anti-Terrorism Act of 2020. Dante Amento will tell us why live. Yes, Dante, good evening. Go ahead.
William, former Supreme Court Justice Francis Hardalesa says that the petitions filed at the Supreme Court lack of legal standing. Petitioners were not able to present actual case that direct or personal injury occurred, wherein their rights are violated under the law. He also cited a court ruling wherein the High Court junked cases for lack of probable cause of credible threat of prosecution.
None of the petitioners in these cases has claimed direct, personal, or constitutional injury, or has alleged actual prosecution under the ATA as to be entitled to relief. I humbly submit that following this court's ruling in Southern Hemisphere Network versus the Anti-Terrorism Council, all 37 petitions should be dismissed.
Hardilesa also has defended the Department of Justice or DOJ, which drafted the implementing rules and regulations or IRR of the law by adding details to make the law clear.
If the DOJ has arrived at narrowing definitions as held in Holder as to save the law from being declared unconstitutional, then I ask, what is so wrong in allowing the DOJ to do its share in defining constitutional law?
He acknowledges the legislative power of Congress to craft a law which is allegedly presumed to be constitutional. The former High Court Justice was invited as amicus curiae or friend of the court to give an expert opinion on the issue. Retired Supreme Court Chief Justice Renato Puno, also an amicus curiae, stresses the distinct characteristics of terrorism, especially nowadays, and that the anti-terrorism law is more radical approach. It allows the government to take precautionary measures to prevent the commission of terrorism or crime.
Number one, it is difficult to deter and detect because it is done in the most clandestine manner and is executed swiftly. Number two, the magnitude of the death and destruction it can cause is unimaginable, given that the perpetrators may have access and can use biological and chemical weapons and other weapons of mass destruction.
Meanwhile, the court has concluded today the oral arguments on the 37 petitions assailing the constitutionality of the law. The court also decided not to continue the interpellation of National Security Advisor Secretary Hermogenes Esperon Jr., but he is given to comment on the omnibus motion filed by the petitioners to strike down his statement last oral arguments. Both petitioners and respondents are asked to submit a memorandum, and the court is expected to release a resolution on the cases brought before them. And that's the latest live. Back to you, William.
Yes, thank you very much, Dante Amento, for those live updates.
Connector to motorists before the end of 2021. According to the department secretary, the road project can decongest Metro Manila. Janice Inhente reports.
DPWH Secretary Mark Villar earlier today revisited the NLEX connector, which is now 35% complete. The 8-kilometer road has reached España in Manila City. The initial 5 kilometers of the elevated expressway from C3 Caloocan to España stretches through Abad Santos Avenue in Tondo and Blumentritt Road. The DPWH will begin the construction of the remaining 3 kilometers from España to PUP Santa Mesa, Manila next month. According to Secretary Villar, they plan to finish the NLEX connector before this year ends.
Makikita nyo po na mas malaki ng accomplishment. At this point, halos 100% na yung site possession namin sa Caloocan side. Yung Manila side na lang, pero mabilis naman ng trabaho namin doon. And we can expect that by this year, at the last quarter this year, ma-open na po yung España portion, which is the 5-kilometer portion of the 9-kilometer alignment.
The NLEX connector is only part of the NLEX SLEX connector, which is one of the major projects under the government's Build, Build, Build program. About 35,000 motorists will benefit from the project once completed. It is expected to reduce travel time from NLEX to the South Luzon Expressway from 2 hours to 20 minutes.
Ang kagandahan po nito ay pwede po ang mga trucks sa connector. So lahat po ng trucks na galing sa port, pwede na papuntang NLEX or papuntang SLEX ay pwede nang dumaan dito. So lalong madidecongest sa Metro Manila.
Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
The Department of Health detected 10 more cases of the B.1.617 SARS-CoV-2 variant that originated in India, bringing the total in the Philippines to 12. Meanwhile, health experts are still studying whether double mutated variant can make a patient's condition worse. Aiko Miguel reports.
The Philippines has now 12 cases of the COVID-19 variant that was first discovered in India. 9 new cases were from the 12 COVID-19 positive Filipino crew of MV Athens Bridge. 4 of them are still admitted at the hospital in Manila and are currently in stable condition, while the other 5 are in an isolation facility. While a seafarer who came from Belgium has been tagged by the Department of Health as recovered last May 13.
More than 20 days po siyang na-isolate and quarantine, and we can ensure na hindi na po nakakahawa ang ating kababayan kung sakaling bumalik po siya sa kanyang local government unit.
The 10 new cases were in addition to the 2 overseas Filipino workers from Oman and UAE who were found positive for the B.1.617.2 variant. According to the DOH, the 2 OFWs' close contacts already completed the prescribed 14-day quarantine and have been discharged from their quarantine facility. Meanwhile, health experts are still studying whether the B.1.617.2 double mutant COVID-19 variant makes COVID-19 patients' condition worse.
Wala pa naman pong ganong kadaming ebidensya ngayon na lumalabas about this Indian variant and its pathogenesis, no, or yung progression ng sakit. Sa ngayon po, meron tayong 4 na naka-admit dito sa isang ospital sa Metro Manila. These are the individuals from MV Athens. 2 po, ang isa sa kanila ngayon ay naka-intubate, pero sabi po ng ospital, binigyan tayo ng update na nasa maayos na kalagayan at mukhang nag-i-improve. 3 po sa kanila are under oxygen support and they are also doing well.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Human waste has now contaminated through to the roads of the Gaza Strip as a result of the continuous bombings from Israeli offense. Marvi Delphine tells us the details live. Yes, Marvi?
See, the Gaza Strip has been left in ruins. Electrical lining and supplies have been cut and plumbing systems have been destroyed, leaving unsanitary human waste from sewages leaking to the ground. Only 4 of 10 electricity lines which power the Gaza Strip are left, cutting access from 230,000. Repair is near impossible with the missile attacks. To this day, 188 Palestinians have lost their lives. Families are buried in rubble still to be rescued. The agricultural minister has declared that livestock will perish without animal feed, criticizing Israel for restricting the animal feed trucks, fuel, and health workers from entering the territory. Water supplies are now also defective with damage from bombings. 250,000 people have no sufficient water to drink and use. Lynn Hastings, the humanitarian coordinator for the United Nations, or UN, has desperately requested for the UN and partners to deliver essential supplies for the survival of the victims. Back to you, Elsie.
Thank you, Marvi Delphine, reporting live from Australia. Taiwan imposes restrictions and community prevention plans for their recent spike in COVID-19 cases. Citizens resort to panic buying in the midst of the lockdown. Joselito Liquido will tell us the details live. Joselito?
Hello, Elsie. Taiwan's Central Epidemic Command Center, or CECC, at a press briefing on Sunday announced 206 new cases of locally transmitted COVID-19 cases and 1 additional imported case. Authorities are quick to impose 2 weeks of restrictions that will shut many venues and limit gatherings. Capital city Taipei and New Taipei moved to a level 3 out of 4 on the alert system, which covers 6.5 million out of 24 million people. And with busy shopping centers and most businesses now closed, citizens anxiously resort to panic buying as lockdowns are applied. Saturday afternoon saw many supermarkets crowded with aisles stripped clean of its toilet paper and instant noodles. While not a total lockdown, the partial lockdown measures encourage people to stay home as much as possible and avoid panic buying, especially since warehouse food supplies are enough for the whole nation. Taiwan President Tsai Ing-wen has also released a public statement encouraging residents to stay alert and safely abide by preventive measures. The president takes emphasis that the challenges are the same ones that they have overcome when the pandemic first hit.
每一个环节，才能让台湾继续在变化难测的疫情中，持续的建立坚固的防疫堡垒。
The outbreak is said to have started 3 weeks ago in April among employees of the National China Airlines and its connected quarantine hotel, Novotel. Infections have spread to their households and close families, which investigators believe to be the result of shortened quarantine period for the airline staff. Overall, these cases have now made up 85% of Taiwan's total accumulated locally transmitted infections. Les Esley.
Thank you, Joselito Liquido, reporting live.